So why does your shoulder joint pop and click? That's a pretty common question we get here at the clinic. There's a handful of reasons that your shoulder makes noise. The main reason is that the joint itself, the glenohumeral joint, isn't tracking well. There's two situations to consider if it's a painful click versus a non-painful click. Reasons for non-painful clicking is a joint can just be naturally loose, the ligaments around the joint. Some people are double jointed, or for example, women who are pregnant or nursing have a hormone called relaxin in their system, and that's just going to loosen everything up around joints, and that'll cause poor tracking of the ball and socket joint where the arm bone comes up into the scapula. Another example of non-painful noisy joint is caused by osteoarthritis, where the different surfaces of the bones where they come together start to wear down, and then the joint just doesn't roll and glide smoothly. Just general wear and tear of supportive structures like tendons of the rotator cuff or the labrum itself. That also prevents rolling of the humerus in the scapula, the rolling and gliding. Wear and tear can come from things like repetitive overhead movements. It's also a sign of muscle imbalance. Painful reasons can include a known injury to the shoulder. For example, if you have you fall on an outstretched arm, or you fall and land on your side. A shoulder dislocation that tends to tear things while the bone is on its way out. It can happen from lifting something heavy and something tears, or just this general sports injury. The pain is coming from inflammation in the joint and swelling, and sometimes structures can get pinched when that joint's not tracking nicely. So if you're experiencing non-painful shoulder clicking and popping, there's really no need to worry. Sometimes you'll feel your shoulder click and pop if you reach overhead to stretch, or if you reach behind your back to scratch it, or if you're reaching up to wash your hair. Really not a need to worry if there's no pain. It's just a sign of wear and tear and likely a fixable muscle imbalance. However, if you do leave it unaddressed, it can eventually turn into a painful click from the worn and torn structures. If you are experiencing a painful pop and click, especially if you have a known injury, I wouldn't leave that unaddressed. I would visit a physical therapist for a diagnosis to determine, if it's a surgical situation or if it can be addressed with non-surgical interventions. If you do come in for an assessment, the things that a physical therapist would focus on is first diagnosing the cause of the pop and click, whether it's painful or not. We'd work on pain management if there is pain. We'd use manual treatment, hands-on treatment to improve the joint mobility and soft tissue mobility around the joint. We'd work on improving shoulder strength and stability, especially overhead. We'd work on range of motion and flexibility of the joint, and overall look at your body mechanics and your posture to make sure there's no deficits there that might be contributing to the poor tracking of the joint. So if you are experiencing popping or clicking in your shoulder and you're not sure whether or not you should worry about it, give us a call here at Loudoun Sports Therapy Center, or click the link below and we can help you out.